My name is Erin Montgomery, and today I'm going to show you how to insert a Foley catheter. So the first thing I would do, I would verify my order. The patient doesn't have any physical ailments that would prevent her from lifting her butt up, so I can slide the chuck under. I would knock on the door, identify myself, and then identify them using two patient identifiers, check their allergies. I've already performed hand hygiene before I came in. I would explain the procedure, provide privacy, and follow my general principles and safety practices. So I'm going to raise the bed up to an appropriate working level. I'm going to go ahead and put it above my waist since this is sterile. So let's just pretend this is a little bit higher. And then I've already put a back blanket on the patient and put a chuck under so I can perform pericare. I'm going to go ahead and put her legs in dorsal recumbent position. And then I've got my soapy water. I'll put my gloves on. So I'm going to get my washcloth. I'm going to spread the labia like that. You can't really see it with my brace on. So spread the labia on the outside, going down, get a new piece of the washcloth, on the other side going down, and then a new piece of the washcloth, and then on the middle going down. Now I would rinse and pat dry, so I can discard this according to company policy. I would take off my gloves, perform hand hygiene again, and then I am going to go ahead and open up my sterile field. While I'm doing this, I'm going to make sure to maintain the sterility of the package. I'm going to touch only the 1-inch border using sterile technique. And I've already cleaned off my tabletop. So now I'm going to reach in and grab my sterile gloves. Like I said, I've already done my hand hygiene before this. So first you're going to get your hands and slide them under the flaps in the middle, making sure not to put your hand over top of the open glove, and then pull outwards. Making sure that the flaps don't go back on top of the gloves. So now you're going to get your dominant hand and get the cuff of the non-dominant glove, making sure to only touch the cuff, and then pull up and step back. Now with your non-dominant hand, slide your hand in, making sure to keep your hands above your waist. And then you're going to get your under the cuff, slide your hand under the cuff of the other glove. And then do the same thing, pick up and step back. Slide your hand in. You can touch sterile to sterile, just make sure you don't touch the outside of the glove with your skin. So now you can fix your cuffs. And then once those are fixed, then you are done, making sure that the gloves do not roll. Now that I have my gloves on, I'm going to make sure not to put my hands above my waist, or below my waist, I mean. So now I'm going to grab my sterile field. Again, only touching the 1-inch border. I would make a cuff with the chuck and slide it under the patient's bottom, but since I don't have an actual patient, I'm just going to verbalize that. Now that I have my sterile field and my gloves on, I'm going to go ahead and move this. Okay, so first I am going to grab my saline. I'm going to remove this, and I can touch this because I do have my sterile gloves on. I'm going to go ahead and grab my tubing and attach the saline. So now that that is done, I can get my lubricant. If I can pick it up. Okay, so I would tear this, put that there, dispose of this, And then I'm going to go ahead and get my catheter and lubricate 2 to 3 inches. And that can sit there. Okay, now that everything is prepared, I am going to again spread the labia with this hand. I'm going to sacrifice this so it's no longer sterile. And then I'm going to get my pre-opened package of wipes. And I am going to open it. Okay, so I am going to get this one and I am going to wipe on the outside going downwards. Dispose. And again, this would be above my waist. I would raise the bed up higher than this. On the other side going downwards. Dispose. And then I would go on the middle, going downwards, and dispose. So now that that is done, I'm going to keep the labia spread. I'm going to grab 2 to 3 inches from the tip of the catheter. I am going to twist inwards and have the patient take a deep breath before I do so. I'm going to twist in. I'm not going to force it in if I can't get it. I'm going to push until I have urine flashback. Okay, so now I'm going to hold the tubing and I'm going to insert the prescribed amount of saline into the balloon. There's no resistance, so it's okay to keep inserting it. And then once the balloon was fully inflated, I would tug on the catheter to make sure that the balloon was inflated and it couldn't come out. So I'm going to remove this. My catheter was already closed off, or the bag was, I mean. So now I would, I'm going to take off my gloves and put on new ones if my hands are soiled. I would do pericare if it was needed. And then I would put on my new gloves after I did my hand hygiene. I would wipe down the leg with an alcohol prep pad, so wipe that down. I would get this. I no longer have to be sterile over my sterile field. I'm going to attach this, and then I'm going to spread this open and attach it to the leg, making sure that there's still enough slack for it to move. And then I am going to get my bag out. There's no kinks in the tubing, and I would attach this not to the bed rail, but to a part of the bed that does not move. That way if the patient moves the bed, it wouldn't pull it out. So I would attach this, making sure that it is below the bladder level, and then I would obtain a urine sample if I needed it. It's not ordered, but if it was, I would make sure to label it with the date, the time, the patient's name, and room number. So now that that's done, like I said, I would do pericare if needed. I would assess the patient. If they're not in any pain or discomfort, put them back down, their bed back down, make sure that they're comfortable in a comfortable position, put their old linens back on, hand hygiene, take off my gloves, hand hygiene, and then pick up all of my stuff, remove the equipment, come back and assess, record, and report.